Okay, we have a pretty packed agenda today, so I'm just going to go ahead and hop right in and get started. Just want to say how pleased I am today to welcome all of you to our overview of our CCJBH 20th Annual Legislative Report. We here at the Council on Criminal Justice and Behavioral Health are mandated to produce a legislative report every year by December 31st. And so we're really happy to share with you all the work that we did last year, as well as talks a little bit about what we'll be up to and what we are up to at the current year. My name is Brenda Graylish, and I'm the executive officer here at CCJBH. And really appreciate everybody taking time out of your very busy schedules to share a lunch and learn opportunity with us, so that we can get you updated on some of our findings and our recommendations from last year, as well as the exciting new projects we have on deck. We're also really, really happy to have our council member, Anita Fisher, here today, who is our consumer and family member representative, who will be doing the bulk of today's presentation and sharing with you some of the great work that the council's been doing. With that, I don't want to spend too much time going into too much more because we have a lot of ground to cover today. I'll go ahead and turn it over to Monica Campos so that she can walk us through a little bit of housekeeping, the agenda, and then we will turn it over to Council Member Fisher. Thank you, everybody.
So good afternoon, everybody. Just some quick notes. This webinar will be recorded, so it will be available on our website. Feel free to share with those that weren't able to attend today. We will have an opportunity for you to ask questions and make a comment. So we ask that you use the raise hand feature. You will be placed in line in the order that you raise your hand. CCJBH staff will then unmute you when it's your turn to speak, and then you'll be able to ask your question. We do ask, because it is a pretty packed agenda today, that you keep your comment or your question to within 3 minutes or less. If we don't get an opportunity to get to your question, we do encourage you to submit your question or your comment to our email address at ccjbh@cdcr.ca.gov. Slide, please. Okay, and our agenda today, we will be, we did welcome and introductions. We will be, the bulk of today will be an overview of the CCJBH 20th Annual Legislative Report. Around 12:45, we hope to open it up for questions and comments, and then we'll be closing our webinar today with announcements, upcoming events that are coming your way. So with that, I'd like to turn it over to Council Member Fisher.
Okay, thank you. Welcome, everyone. And I am excited about this honor to present CCJBH's 20th Annual Legislative Report. So we'll start with background on the Council on Criminal Justice and Behavioral Health. So the council was established under California Penal Code 6044. It is a 12-member council chaired by the Secretary of the California Department of Corrections and comprised of Department of State Hospital, Department of Healthcare Services, and appointed expert representatives from the criminal justice, behavioral health fields such as probation, court officers, and mental health professionals. Also, as required under Penal Code 6044H1, the CCJBH shall provide a report to the legislature by December 31st of each year. The CCJBH serves as a resource to assist and advise the administration and legislature on best practices to reduce the incarceration of youth and adults with mental illness and substance use disorders, with a focus on prevention, diversion, and reentry strategies. So next we'll cover the overview of the CCJBH's 20th Annual Legislative Report. So the coronavirus disease of 2019, public health emergency, created unexpected opportunities to develop innovative approaches to support individuals with behavioral health needs who are involved in the juvenile and adult criminal justice systems, hereafter referred to as the BHJI population. There have been unprecedented federal and state investments to improve access to health and behavioral health care, address the need to increase housing, eliminate homelessness. Throughout 2021, CCJBH continued to pursue its mission of supporting proven strategies that promote early intervention, access to effective treatments, planned reentry, and preservation of public safety, taking into consideration the impact of the pandemic, as well as the significant federal and state investments made in the delivery systems that impact the BHJI population. The full council meetings focused on the behavioral health and criminal justice systems, with an emphasis on the Department of Healthcare Services California Advancing and Innovating Medi-Cal, CalAIM initiative, housing and homelessness, CCJBH projects, including public health meets public safety, lived experience projects. And you can see the Appendix D for additional information on the 2021 full council meetings page. Through the Juvenile Justice Diversion Reentry work groups, CCJBH made several findings and developed recommendations for system improvements. So next we'll cover the CCJBH Juvenile Justice work group recommendations. The Juvenile Justice Work Group focused 2121 efforts on Senate Bill SB 823, Juvenile Justice Realignment, the impact of the COVID-19 on children and youth involved in the juvenile justice system, particularly the return to in-person learning after 1 year of home-based schooling that occurred as a result of the shelter-in-place orders. While detailed work group recommendations may be found in the body of the report, highlights regarding justice-involved youth are as follows. A distinction must be made between prevention and intervention, targeting at-promise youth who are at risk of becoming involved in the juvenile justice system, and intervention, targeting youth who have had, at a minimum, at least one law enforcement contact. A variety of prevention strategies should be employed, such as early identification, tutoring, truancy intervention, family interventions, mentors and community programs, and all possible efforts must be made to divert youth away from the juvenile justice system if they have infractions to minimize life disruptions. Intervention efforts should be collaborative across all relative systems and formally established systems, such as a cross-agency memorandum of understanding, which includes evidence-based practices in coordinated case planning, collaborative case planning and programming, the positive use justice model, juvenile wraparound, and the crossover youth practice model. With regard to SB 823, case management and risk assessments should be informed by peers with lived experience. Youth across the state should have equal access to all services. There should be a focus on treatment rather than overly punitive approaches to support youth, and educational opportunities should be expanded to align with strategies that have traditionally been provided by CDCR's Division of Juvenile Justice, including college or post-high school and workforce development. There are a number of school-based efforts that state and local officials may want to consider to mitigate the impact of the pandemic for the BHJI youth and in general, such as recognizing the difference between behavioral health, such as anxiety, depression, and behavioral health needs, such as physical aggression, thereby being prepared to provide behavioral health informed response rather than respond punitively. Staff working with children and youth should be trained to respond compassionately and know what to expect and how to respond accordingly. Services should be preventative, and educators should be trained to recognize the need for preventative services. So individual support plans, which include student advocates, should be established to formally support children and youth in academics, behavioral health, pro-social family environments, within school and justice systems, and any other relevant entities. Treatment for substance use disorders should be provided to students in convenient settings rather than being a burden distraction that is disruptive to the overall progress. Additional recommendations that address disproportionately incorporation of youth voices to drive meaningful changes, visiting youth in their homes to gain a better understanding of the community in which they are living, evaluating youth holistically beyond their test scores, including examining their case history, re-envisioning staffing patterns within the multi-tier system of support framework, and establishing as much uniformity as possible and sharing best practices. Having counties support the California Department of Education as they are trying to provide statewide leadership for children and youth, and establishing accountability measures to monitor outcomes. So now we're going to cover CCJBH Diversion Reentry Workgroup recommendations. In 2021, the CCJBH Diversion Reentry Workgroup focused on innovative strategies to support individuals returning home from prisons and jails in their communities and preventing future returns to prison. The COVID-19 added urgency to this ongoing challenge, while detailed recommendations from this work group may be found in the body of this report. Highlights are summarized as follows. And when you check on the live report, there will be links where you can go directly to this information. Ensures sufficient capacity at all levels in California's behavioral health continuum of care, particularly psychiatric inpatient services. Expand provider capacity to serve the BHJI population by identifying the hidden network of community-based organizations that serve justice-involved individuals. Evaluate the feasibility of transitioning such organizations into California's Medicaid program, Medi-Cal, and other established provider networks, maximizing full federal reimbursement. Ensure coordination between all criminal justice system partners and Medi-Cal managed care plans, and providers, including enhanced care management and other providers. Prioritize the BHJI population for housing homelessness projects and establish pilot housing projects, as well as continue to disseminate recent recommendations and identify key areas of impact and advocate for the BHJI population. Strengthen symptom capacity by implementing training and technical assistance. Expand and refine data collection and cross-system data linkage on the behavioral health needs of the justice-involved population for issues including, but not limited to, expanded and improved data identifying the prevalence of mental health and substance use disorder needs in jails. Consider using a pay-for-success model for reimbursement. Provide training and technical assistance about the effective establishment and implementation of involuntary medication orders. Explore additional strategies to address the issue of engagement, including the use of assisted outpatient treatment or Lohr's Law and psychiatric advance directives. Inform and engage individuals with lived experience in the behavioral health and criminal justice systems. Focus efforts both within and across systems to implement diversion programs. So next, we're going to cover and update the 2025 policy goals. Goal number 1, the prevalence rate of mental illness and substance use disorders in jails and prisons should be similar, if not equal to, the prevalence rate of mental illness and SUDs or substance use disorders in the community. Goal number 1, update. Though some of the data sources were updated since the 2020 CCJBH legislative report, results did not change, and there continues to be reliance on jails and prisons to serve individuals with behavioral health conditions. Mental illness. The prevalence rate for any mental illness in the general population in California is 15.9%, yet it is 28.6% in the prison system and 28.3% in the jails. So goal 1 update continued is the prevalence rate for serious mental illness, SMI, in California is 4.2% in general and 6.4% in the prison system. Data pertaining to SMI in the jails is not available statewide at this time. Substance use disorders. 8.1% recorded in California in general, approximately 80% in the prison system, and no data available statewide for jails. So there is also a table that indicates, it includes also this prevalence rate against the numbers across the United States. So goal number 2, community-based services, particularly residential, are robust enough to meet demand, starting with ensuring that those with multiple needs are not left behind due to their numerous and complex challenges. So the goal number 2 update, in 2021, CCJBH established metrics for goal number 2, which seeks to capture adequate system capacity to meet the needs of the BHJI population. The capacity of the Medi-Cal behavioral health system as of December 2020 is as follows. Out of 26 Medi-Cal managed care plans, or MCPs, 22 received a conditional pass for compliance with network adequacy standards subject to a resolution of a corrective action plan, while 4 MCPs fully complied with network adequacy standards. Of 22 MCPs that received a conditional pass, all 22 resolved their corrective plan by May of 2021. Out of 56 county mental health plans, or MHPs, 43 received a conditional pass for compliance with network adequacy standards subject to resolution of a corrective action plan, while 13 MHPs fully complied with network adequacy standards. Of the 43 MHPs that received a conditional pass, 41 resolved their corrective action plan by May of 2021. These certifications do not include mental health residential or psychiatric inpatient services, as relevant data are not yet available. Out of 30 drug Medi-Cal organized delivery systems, or DMC-ODS counties, all received a conditional pass for compliance with network adequacy standards, subject to resolution of a corrective action plan. To date, 6 DMC-ODS counties remain on a conditional pass and have not yet resolved their corrective action plan. With regard to addressing and treating criminogenic needs, nearly 100% of current individuals incarcerated at CDCR, as well as individuals on parole, have a California static risk assessment score. About 40% of individuals on parole participated in programming consistent with their identified risk needs. Analysis of data from the SB 678 annual assessment indicates that 94% of responding probation departments reported that at least 3/4 of their high-risk caseloads were administered a risk assessment tool, and that the majority of individuals on probation assessed as minimum risk or high risk received services responsive to their needs. For fiscal year 2020 to 2021, 61% of SSA/SSI applications submitted by CDCR were in a pending status at pre-release. 23% were approved and 16% denied. Point-in-time data from CDCR indicate that of the 45,119 individuals who were on parole on June 30th, 2021, approximately 17% were homeless or residing in a shelter. And of these individuals, 36% had a mental health designation, and about 60% had a probable or likely substance use disorder. Goal number 3, through consistent dedication to workforce development, quality education and training, and ongoing technical assistance to an array of service providers and partners, Californians benefit from professionals having core competencies that provide effective integrated correctional and behavioral health services to achieve recovery and reduced recidivism. Goal number 3, update. It is well known that there is a significant workforce shortage and relevant training to address the needs of the BHJI population. Given the limited availability of data and focus on the other CCJBH priorities, metrics have yet to be developed for goal number 3. This will be part of the CCJBH's, oops, I got blocked there, sorry. The CCJBH's 2022 efforts, sorry about that. Goal number 4, through state leadership to support data-driven practices and policy-making among criminal justice and behavioral health systems, continuity of care and desired public safety and health outcomes improve significantly. Work is, so the goal for update, work is an ongoing across multiple state departments to improve outcomes for the BHJI population, including the following. CCJBH conducted data analysis through its CDCR-DHCS Medi-Cal Utilization Project, or MCUP. CCJBH expanded data reporting through its Public Health Meets Public Safety Project, publishing an online dashboard that inventories publicly available data sources. Goal 4 update continued. The Department of State Hospitals to leverage data to inform decisions about the felony incompetent to stand trial, FIST population, especially the department's existing wait list of FIST referrals. The Mental Health Services Oversight and Accountability Commission continued efforts on the data-driven recovery project, which supports criminal justice and behavioral health data linkage at the local level. And next we'll cover CDCR-DHCS Medi-Cal Utilization Project. Data analysis on the following metrics have been conducted for individuals transitioning from incarceration in fiscal year 2017 to 2018. Timely Medi-Cal enrollment, timely Medi-Cal managed care plan enrollment, mental health, non-specialty and specialty service utilization, and substance use disorder treatment utilization. Approximately 82% of individuals transitioning from incarceration were enrolled onto Medi-Cal within 1 year of release. Among individuals who were enrolled into Medi-Cal, there was some delay in enrolling onto the managed care plan post-release. With MCP enrollment rates at 32% within 1 month of release and 55% within 2 months of release. There is steady improvement in MCP enrollment such that 85% were enrolled into MCPs within 1 year of release. In line with DHCS performance outcomes system reporting, CCJBH measured penetration as having at least one contact with the Medi-Cal, with the Medi-Cal program, and engagement as having as having 5 or more contacts. Beneficiaries with mental health needs penetrated in and engaged with at least one of the Medi-Cal behavioral health delivery systems at a rate of 55% and 36% respectively. Beneficiaries with substance use disorder needs penetrated in and engaged with at least one of the Medi-Cal behavioral health delivery systems at a rate of 30% and 16% respectively. Beneficiaries with co-occurring mental health and substance use disorder needs penetrated in and engaged with at least one of the Medi-Cal behavioral health delivery systems at a rate of 56 and 35%, respectively. These results point to a need to strengthen facilitated referral and linkage from correctional health care services to community health care providers, engage beneficiaries so that they have the willingness and ability to utilize needed services. Major investments have been made through the Integrated Substance Use Disorder Treatment Program, but are not reflected in these analyses given the fiscal year examined. Implementation of CalAIM, once approved, will allow for the establishment of an infrastructure for in-prison/jail facilitated referral and linkage. And next, we'll cover the 2021 CCJBH project updates. So SB 369 veto message. As per the governor's veto of SB 369, CCJBH worked with CDCR, California Correctional Healthcare Services, CCHCS, and stakeholders to evaluate the barriers of reentry and determine what steps need to be taken to overcome those barriers. The final report, entitled Successful Reentry / Transition from the California Department of Corrections and Rehabilitation, Identification of Barriers and Solutions to Address Them, was published in August 2021. And you can access that report on the CCJBH website. And there will be a link in the copy of this PowerPoint. Public health meets public safety. 2-year CCJBH project being conducted in consultation with the Council of State Government, CSG Justice Center. Aims to utilize data to track, monitor, and ultimately reduce the prevalence of the BHJI population in California's justice system. In 2021, CSG developed for CCJBH's website an open data sets inventory that serves as a compilation of current publicly available data related to the justice and behavioral health systems. CSG facilitated 2 focus groups to capture feedback input from CCJBH's Lived Experience Program, LEP. Contractors to inform a larger, overreaching data reporting framework anticipated in 2022. That may be used to inform policy and decision-making. Equity, diversion, and inclusion. In 2021, CCJBH staff began the process to review the mission and vision statements of the council to reflect the need to mitigate disparities for the BHJI population. CCJBH staff has an ambassador on the CDCR/CCHCS Government Alliance for Race and Equity, Capital Cohort Team. Cohort sponsored by Race Forward and the Health in All Policy Strategic Goal Council. This council provides assistance in communicating to the staff and council the need to develop policies and practices aimed at diversity, equity, and inclusion. Lived Experience Project, or LEP contracts. CCJBH has 2 LEP contracts. Regional LEP, 4 regional contractors working to uplift the voices of individuals who have lived experience with the behavioral health and criminal justice systems. Regional LEP project highlights include project contractors training, mentoring individuals with lived experience to develop advocacy skills to inform and influence state and local policy conversations, strengthen and expand capacity to more appropriately support and serve the BHJI population, and serve on CCJBH's LEP advisory team to provide subject matter expertise. Lived experience project contracts continued. California State University Sacramento CSUS LEP project gathers input on how to effectively advance the employment of individuals with lived experience in the criminal justice and behavioral health fields. Project highlights include, in September of 2021, CSIS and CCJBH published an initial report on hiring individuals with lived experience in the behavioral health and criminal justice sectors. The report was entitled Successful Approaches to Employing Individuals with Lived Experience in the Criminal Justice and Behavioral Health Fields. CCJBH and CSUS then convened a workshop on solutions in the same month to gather input on potential solutions to hiring barriers. Forensic Peer Support Specialist, FPS. CCJBH embarked on a project to research publicly available nationwide resources regarding FPS models. Efforts to date have included meeting with experts from the states of Georgia, Pennsylvania, and Connecticut who have experience implementing FPS models. CCJBH's findings and recommendations are currently being formulated into a report, which, once drafted, will be shared for stakeholder review and input before finalizing. California Advancing and Innovating Medi-Cal, CalAIM. CCJBH remains actively committed to supporting DHCS's CalAIM initiative, a multi-year effort to improve the quality of life and health outcomes of the Medi-Cal population by implementing broad delivery system, program, and payment reforms. In August 2021, during the federal public comment period, CCJBH submitted to the Centers for Medicare and Medicaid Services a letter of support for DHCS's Section 1115 demonstration waiver. A CCJBH also prepared for justice system partners a brief overview of Department Healthcare Services California Advancing and Innovating Medi-Cal, CalAIM proposals that impact the criminal justice population. And there will be a link provided to that report. Pre-trial diversion training and technical assistance. CCJBH completed the final series of diversion webinar trainings to counties by holding 3 trainings on criminogenic needs and risk mitigation, entering into a 1-year diversion training and technical assistance contract with CSG Justice Center in June 2021, which includes ongoing subject matter expert specialty consultation and technical assistance throughout fiscal year 2021-22 to support county diversion planning and implementation, a final report summarizing the effectiveness of existing mental health diversion policies and practices, as well as recommendations on how changes must be made in order to advance mental health diversion programs in California. Juvenile Justice Compendium and Toolkit. CCJBH is in the process of producing a juvenile justice toolkit and compendium that will focus on assisting counties as they implement activities related to SB 823, Juvenile Justice Realignment, providing a compilation of information related to best practices and evidence-based programs that have been shown to be effective in serving justice-involved youth who have behavioral health needs. Request a proposal posted on December 9th, 2021 to February 4th, 2022, and the bid was awarded to Rand Corporation on February 22nd, 2022. Housing and homelessness. In August 2021, CCJBH and the CSG Justice Center hosted a virtual event to celebrate the public launch of their report, Reducing Homelessness for People with Behavioral Health Needs, Leaving Prisons and Jails Recommendations to California's Council on Criminal Justice and Behavioral Health. The event provided an overview on the key findings and recommendations to increase housing opportunities. Key state leaders and local partners expressed the importance of prioritizing the BHJI population using available housing funding. Housing and homelessness continued. Beginning December 2021, CCJBH and CSG began hosting a 5-part webinar series focused on how key stakeholders from across the justice, behavioral health, housing, and other systems can help people successfully transition out of the justice system and into the community by connecting them with housing options that meet their needs. Concluding webinar taking place Thursday, April 28th, 2022 on leveraging rental assistance and supportive service funding for people with behavioral health needs leaving jails and prisons. The legislative report includes appendices that summarize recent investments in the following systems: behavioral health system in Appendix A, criminal justice system in Appendix B, and housing in Appendix C. 2022 priorities. CCJBH will continue working to strengthen services, support the development and implementation of primary care and behavioral health treatment with criminogenic interventions for the BHJI population, including but not limited to CalAIM, the Behavioral Health Continuum Infrastructure Program, and diversion programs identify and promoting optimal strategies on how best to engage and deliver these services, and housing, advocate for the prioritization and development of available affordable housing resources for the BHJI population, including promoting cross-system education and collaboration. Under workforce, establish and expand the workforce across multiple sectors to better engage and serve the BHJI population, including use of the forensic peer support specialist classification. Under data, continue exploring opportunities to share data across sectors to further build the Public Health Meets Public Safety dashboard and expand Medi-Cal utilization project analyses to meet the CCJBH goals related to data-driven policies. Under community involvement, juvenile justice and diversion reentry work groups with presentations focused on priority subjects such as determined by each work group's council member advisors, continued regional lived experience projects. And under education, hosts special events to educate cross-sector stakeholders on topics related to the BHJI population. Future CCJBH projects celebrate the 20th anniversary of CCJBH by reflecting on the Council's accomplishments to date and develop processes to reinstate best practices awards to highlight agencies and programs that are using evidence-based practices to improve the systems that serve the BHJI population. A full version copy of this 2021 CCJBH 20th annual legislative report can be found on the link in the copy of the presentation that will be on the website. Thank you.
Thank you so much, Councilmember Fisher. Really appreciate you going through so much information with our audience today, just in terms of the work, the recommendations that came from our juvenile justice and our diversion and reentry work groups, as well as just from our council meetings and conversations with the council members, given all that's happening today, as well as the updates on our 2025 goals and the Medi-Cal utilization project. And we've got a lot going on. And so hopefully there's some great data and information in the report for everybody to have as like a desk reference. That's really something that we had in mind while we were designing it. I know Councilmember Fisher also had flagged the appendices at the end, the 3 appendices, A, B, and C, that really give some snapshot, quick, easy references to what's happening in the behavioral health, the justice systems, and housing. And we'll keep trying to build out as much as we can to make sure that we're keeping everyone informed and trying to keep as much information of all the wonderful efforts underway in one place so that everybody can use as a resource. And so I guess with that, we can open it up for questions. I know there were some questions that had popped up in the chat and the Q&A, one having to do with getting the website, the presentation. And so we will get that posted to our website. We're just in the process of making it ADA compliant. So we'll get that posted as soon as possible. I did put the report in both the chat and the Q&A. So all this information is extracted directly from the report. So if there's something you want to reference from now until the time we get it posted, please feel free to look at the full report. With that, we'll look to see if anybody has any questions or comments or reflections. No.
I don't see any hands going up, Brenda.
Okay, I'm not seeing any either. Well, I know that was a lot of information covered in a very short period of time. So hopefully it packed a good punch and a great bit of information to help all of you do your work. Really appreciate all the work that you guys do. Oh, thanks, Katie. Appreciate the nice words and agree. Thank you so much, Councilmember Fisher, for doing this for us and all the work that you do on our council and the perspective that you bring, the great conversation that we have in our council meetings. And again, appreciate all of the work that all of you are doing in the field, really to help address the needs of this extremely vulnerable population of individuals that we have the privilege to serve. So I think with that, if there aren't any questions, if anybody thinks of anything afterwards, we can always feel free to get a hold of us. Let's go to the next slide. We also have, oh, thanks so much, guys. So our upcoming events, we have our housing recommendations and implementation webinar. So as Councilmember Fisher mentioned in her presentation, some of that work that we're doing with the Council on State Governments, Justice Center, working to implement, or at least the webinar series on the recommendations from the housing report that we launched last year. We'll have our 5th and final presentation next month on April 28th. So really have an exciting agenda that we're building out with CSG to really get folks with lived experience talking about what they need, and then having the Department of Healthcare Services coming to talk about what's going to be available through CalAIM, as well as some other efforts that are underway from the Home and Community-Based Services Spending Plan at the Department of Healthcare Services. And then we'll have our full council meeting on Friday, April 28th. That's will take place from 2 to 4:30 in the afternoon. We will be moving to in-person. So the executive order that authorized the Zoom meetings or the virtual council meetings is ending today. Today's the last day. So we as a council will be moving back to in-person meetings. We are working to try to get a teleconference capability so it could be a hybrid meeting. So we are working on that. And so hopefully we will have that technology in place by that time, and we can really keep our audience as broad as possible. That full council meeting will feature the Substance Use Respite and Engagement Program, which is a program here in Sacramento County led by WellSpace, but also is funded through the county Department of Behavioral Health Services. And the program is kind of a deflection, diversion program, so that when law enforcement encounters individuals who are on the in our community who seem to be under the influence of a substance or experiencing psychotic issues, can be then diverted or deflected away from the jail and instead taken to a site that can, this SHORE program site, which is about a block away from our county jail here in Sacramento, to go down a treatment path instead of a justice path. So we're excited to welcome them here to come present to us on the 29th on the great work that they're doing, especially given all the investments with BCHIP and CalAIM, so much happening right now and all the funding opportunities to be able to have these types of programs across the state. And then in May, we'll have our 2 work group meetings. Juvenile Justice will be held on May 13th. We'll be focusing on youth SUD treatment, mostly for kids in the justice system who the interaction with the behavioral health system, as well as education. And then Diversion and Reentry work group, we're looking to focus on diversion, both felony and what was misdemeanor incompetent to stand trial with the DISH diversion program and the SB 317 efforts that are happening. As always, we have our website. We're constantly updating it. So hopefully you all find that, if you've used it before, to be a great resource. As Monica had mentioned at the beginning, we have our email account that we're always monitoring, CCJBH@CDCR.ca.gov. Feel free to email us if you end up having questions on this presentation, or if you have ideas that you want to share with us, or any other questions that you have, feel free to use that email address to get a hold of us. And then we also have our listserv that we send out Friday emails every single Friday with the latest and greatest. We're trying to monitor all the work that's happening in healthcare, behavioral healthcare, housing, and social services, anything that we have that's happening, and criminal justice systems, everything that's happening that we can get our hands on, we try to put in one place and send out a blast every Friday to make sure that everybody is aware of anything that we're aware of happening out there, if it would help support the work you're doing. I think with that would conclude our webinar, our Lunch and Learn session on our legislative report. Another big thank you to Councilmember Fisher for walking us through all of the amazing work that our council members and our wonderful team here at CCJBH, the staff team, have done to really bring this to life in the last year. And we are now getting ready to start writing the 22 report that will be due at the end of this year, with all the work and the discussions we'll be having. So thank you to everybody for taking time out of your schedules today and for tracking our efforts here at the council on criminal justice and behavioral health. Thanks, everybody.